This is Dr. Hesch at the Hesch Institute in Aurora, Nevada. Aurora, Nevada. We moved from Henderson, Nevada this year to Aurora, Colorado. So we are in Colorado. And I have a master's and a bachelor's and a doctorate in physical therapy. I'm a slow learner. Okay? Those degrees took a long time, but hey. This is a case that I want to post because I like posting this example several times, hoping that that can generate more research down the road. I don't think that many people recognize this pattern. What we find in Ed is that he has a reduction of supination, probably to the degree to about 20 degrees. If I have the elbow fully extended and I try to rotate his forearm into full supination, he lacks at least 15 degrees on this side. And on this side, I can supinate him all the way just slightly past neutral, maybe 5 degrees. Now, he did fracture this arm in a severe accident. He was in a large truck, and another large truck front-ended him and did quite a bit of damage. Can you point to where that bone was sticking out, please?
Right here.
Okay, so it was the ulna that broached the skin, and how was that repaired?
Surgically.
Okay, but no plate, no pins, no hardware.
No, they I don't know what they did for sure. They just put it back together and
it healed.
Sutured up.
Yep, yep. So you have a healed ulnar fracture,
right.
But again, it's not the radius that fractured.
No, it's when you look at
a little deformity.
Yeah, it's deformed.
Sure. Okay. So when I dig into this sulcus here, it's pretty shallow here in contrast to this. I don't know if you can feel the difference, but I can slide off that styloid process of the radius and fall into a sulcus. And when I come off the styloid here, it's almost like I just keep sliding forward. Okay, that's one thing that I find in this kind of presentation. Another one being that on this side I can't traction. I can't get any more inferior glide of that radius. On the non-involved side, I get a little tiny bit of play. Do you see how the force goes through this structure? There's force transmission through it.
I don't really pick it
You
up.
can't tell. I can feel a little small bounce in there. And when I come here, I might as well be pulling on a piece of steel.
Okay, now I know what you're feeling when you're doing the
Good.
Okay.
Let's compare strength. And this is a manual muscle test, and we're not a research lab. And I'm the camera guy as well. So it's not a research lab, it's a clinical situation. I have a home office. And I want you to show me how strong you are. Do not let me roll the palm up. At the count of 3. 1, 2, 3, go for it. So you're pretty strong there on your left. Okay? We're going to do the same thing over here. Bend your elbow about 90 degrees. I'm going to hold you in the same location. At the count of 3, do not let me roll the palm up.
Right.
Okay? You ready?
Yep.
1, 2, 3. So that was pretty easy.
Yeah, I can't
Okay.
hold that.
I'm going to see if this is treatable, and I don't know if it is or isn't. I'll know in 2 minutes. Okay, if I can restore that rotation and superior glide.
Okay.
All right, so here's a quick look at my wall, and there are some degrees on that wall, and to people with which this is foreign, they might think it's some form of quackery. I've had interesting comments made, but I'm going to spend 2 minutes with you, and I hope they like glass because they're looking at glass. All right, so let me set a timer for 2 minutes, and I'll treat you, and we will find out if I was able to change it or not. And if I'm not able to change that, the assumption I'm going to make is that more force and more time is not going to work.
Okay.
Okay, my experience tells me that I should be able to correct it, although the unknown is that I haven't done this in someone with a fracture of the ulna. So you're a new research subject. Correct.
Guinea pig.
Correct. And I actually see this pattern fairly often.
Really?
So maybe if I have 10 clients, like 2 of them might present this way. When I teach workshops, if I have 30 in the room, at least 2 will have this. And they typically respond very well. I don't recall anyone not responding, but if they had a bleed in the joint or a bleed in the connective tissue
right.
Around that articulation where the ulna and the radius connect, then I think that would change the probability that I would help it. But I'm looking at your forearm and I'm seeing movement up there. Can you see the soft tissue?
Yeah.
You see that? So I think that I'm able to make an effect with it.
Okay.
And probably another minute and we'll be able to find out.
All right. Yeah, all the bones that were up in the, I'd say the back of the hand, they were all crushed too.
Really? It's incredible.
Yeah.
It's a remarkable injury, and as you stated, it's surprising. We stopped at a minute and a half. As you stated, the physician said it's remarkable that you did live through it.
Yeah.
All right, so let's
up there
retest
again?
that. Yep, we're at 90 degrees here.
Okay.
And at the count of 3, I want you to fight me. Don't let me, roll the palm up. 1,
Okay.
2, 3. Okay. What are
Still
your
do
thoughts?
it, but I had a lot more strength this way.
That's what I felt.
Yeah.
I still unwinded it.
It took you a lot more effort to twist it.
And longer too.
Yeah.
Yeah. Okay, so let me see if we have that little bit of play. So now I feel like there's a little bit of give. It no longer feels like I'm pulling on an immobile steel rod.
Right, but it's not as much as in this one.
Very good. Very good. I wouldn't know that. That was subtle.
Oh.
But I
okay.
trust what you feel. Okay?
Yeah.
So move the arm around and you may or may not notice any difference.
Well,
It wasn't
I don't
something
know.
you complained about,
no,
but
it's been there for 30 years. So.
yeah. It might be that during the week you'll notice some things, and you might not.
Yeah.
In my
Depends
world,
on what you're doing.
Sure. And in my opinion, prevention makes sense. And I have no way of looking down the road and say helping this today means that
Yeah.
a few years down the road you're going to be able to prevent this injury or anything like that. But I like to optimize function in the body, especially if it only takes 5 minutes of my time. So without a whole lot of research to guide me, this is one more example, one more case of someone that had inhibition of some muscles that allowed me to pronate your forearm, and it did get a little bit stronger, and you, the client, feel the play in that structure now. So I'll stop here, and I should thank you for letting me film that.
Sure.